Question 1. Which action should the nurse take first when a patient with sepsis develops hypotension and a rising lactate level? A. Notify the healthcare provider immediately. B. Administer prescribed vasopressors. C. Initiate a fluid bolus as ordered. D. Draw blood cultures before starting antibiotics. Answer. C. Initiate a fluid bolus as ordered. Question 2. Which patient should the nurse assess first during morning rounds on a sepsis unit? A. A patient with a temperature of 100.4 degrees Fahrenheit and mild confusion. B. A patient with a BP of 88/52 millimeter of mercury and HR of 122 BPM. C. A patient receiving 4 antibiotics with WBC 12-000/mm superscript 3. D. A patient complaining of fatigue and muscle aches. Answer. B. A patient with a BP of 88/52 millimeter of mercury and HR of 122 BPM. Question 3. Which task is most appropriate for the nurse to delegate to an unlicensed assistive personnel? UAP, caring for a patient with sepsis. A. Administering 4 antibiotics. B. Checking peripheral pulses. C. Assisting the patient to the bathroom. D. Monitoring hourly urine output. Answer. C. Assisting the patient to the bathroom. Question 4. Which of the following assessment findings in a septic patient indicates the need for immediate intervention? A. Warm, flush skin. B. Urine output of 50 milliliters per hour. C. Blood pressure of 84/40 mmHg. D. Respiratory rate of 20 breaths per minute. Answer. C. Blood pressure of 84/40 mmHg. Question 5. Which nursing action is a priority in the early management of a patient with suspected sepsis? A. Administering antipyretics. B. Drawing blood cultures. C. Initiating oxygen therapy. D. Starting enteral nutrition. Answer. B. Drawing blood cultures. Question 6. A patient with sepsis is receiving norepinephrine. What is the most important parameter to monitor? A. Serum creatinine. B. Urine output. C. White blood cell count. D. Body temperature. Answer. B. Urine output. Question 7. Which order should the nurse question for a patient with septic shock? A. Administer 4 fluids rapidly. B. Insert a Foley catheter. C. Start norepinephrine for MAP less than 65 millimeters of mercury. D. Provide oral acetaminophen every 4 hours. Answer. D. Provide oral acetaminophen every 4 hours. Question 8. The nurse is caring for a patient with sepsis. Which finding suggests that the patient is progressing to septic shock? A. Fever and tachycardia. B. Warm skin and flushed appearance. C. Sudden drop in blood pressure and altered mental status. D. Elevated white blood cell count. Answer. C. Sudden drop in blood pressure and altered mental status. Question 9. Which patient should the nurse prioritize for reassessment? A. A septic patient with new onset of confusion. B. A patient scheduled for discharge with resolved infection. C. A patient ambulating for the first time post-sepsis. D. A patient complaining of mild nausea. Answer. A. A septic patient with new onset of confusion. Question 10. Which instruction is most important when educating a patient with sepsis about preventing future infections? A. Use antiseptic mouthwash twice daily. B. Take probiotics regularly. C. Complete the full course of prescribed antibiotics. D. Avoid crowded public places. Answer. C. Complete the full course of prescribed antibiotics. Question 11. What is the most appropriate nursing action when a sepsis patient develops mottled skin and decreased capillary refill? A. Reassess in 30 minutes. B. Notify the rapid response team. C. Elevate the head of the bed. D. Apply a warm blanket. Answer: B. Notify the rapid response team. Question 12. A nurse receives lab results for a patient with sepsis. Which value is most concerning? A. Hematocrit 40%. B. Platelets 90,000/mm superscript 3. C. Sodium 138 milliequivalent/L. D. Glucose 110 milligrams per deciliter. Answer: B. Platelets 90,000/mm superscript 3. Question 13. When delegating to an experienced LPN on a medical unit, which task is most appropriate? A. Assessing a new septic patient's lung sounds. B. Titrating for vasopressor medications. C. Administering scheduled oral antibiotics. D. Developing a care plan for a septic patient. Answer: C. Administering scheduled oral antibiotics. Question 14. Which patient assignment is appropriate for a new graduate nurse? A. A patient on norepinephrine for septic shock. B. A patient with resolved sepsis awaiting discharge. C. A patient undergoing emergency intubation for sepsis-related ARDS. D. A patient requiring hourly hemodynamic monitoring. Answer: B. A patient with resolved sepsis awaiting discharge. Question 15. Which finding in a septic patient requires immediate communication with the healthcare provider? A. Temperature of 100.6 degrees Fahrenheit. B. Heart rate of 92 BPM. C. Respiratory rate of 32 breaths per minute. D. Hemoglobin of 11 G/DL. Answer: C. Respiratory rate of 32 breaths per minute. Question 16. Which of the following should the nurse assess first after initiating for antibiotics for sepsis? A. Temperature. B. Urine output. C. Allergic reaction. D. Blood pressure. Answer: C. Allergic reaction. Question 17. A patient with sepsis is being transferred to the ICU. What information is most important to communicate to the ICU nurse? A. Family contact information. B. The patient's appetite. C. Time and type of last antibiotic dose. D. Daily weight trends. Answer: C. Time and type of last antibiotic dose. Question 18. Which action best reflects critical thinking in a nurse managing a septic patient with fluid overload risk? A. Administer all fluids as rapidly as ordered. B. Monitor lung sounds and adjust infusion rate based on policy. C. Wait for symptoms of overload before acting. D. Defer all fluid-related decisions to the physician. Answer: B. Monitor lung sounds and adjust infusion rate based on policy. Question 19. Which indicator best reflects that a septic patient is responding to treatment? A. Decreased level of consciousness. B. MAP of 60 millimeters of mercury. C. Urine output of 40 milliliters per hour. D. Worsening lactic acid levels. Answer: C. Urine output of 40 milliliters per hour. Question 20. What is the nurse's best action when a septic patient is scheduled for a CT scan but has unstable vital signs? A. Send the patient with a UAP and call radiology. B. Delay the scan and stabilize the patient first. C. Increase for fluids and proceed with the scan. D. Administer sedation to keep the patient calm. Answer: B. Delay the scan and stabilize the patient first. Question 21. Which intervention should the nurse prioritize for a patient with sepsis and a serum lactate level of 5 millimoles per liter? A. Apply antiembolism stockings. B. Administer antipyretic medication. C. Initiate aggressive fluid resuscitation. D. Encourage increased oral fluid intake. Answer: C. Initiate aggressive 4-fluid resuscitation. Question 22. A nurse is caring for 4 patients. Which one should be assessed first? A. A septic patient who received antibiotics 1 hour ago. B. A post-septic patient ambulating in the hallway. C. A patient with sepsis and new-onset dyspnea. D. A patient requesting a PRN analgesic. Answer. C. A patient with sepsis and new-onset dyspnea. Question 23. A patient with sepsis has a central line. Which task can the nurse safely delegate to a UAP? A. Flushing the central line. B. Changing the central line dressing. C. Reporting redness around the central line site. D. Administering for antibiotics through the central line. Answer. C. Reporting redness around the central line site. Question 24. Which finding suggests a patient with sepsis is developing disseminated intravascular coagulation (DIC)? A. Bruising and oozing from venipuncture sites. B. Pale skin and cold extremities. C. BP of 100/60 mmHg with tachycardia. D. Decreased bowel sounds. Answer. A. Bruising and oozing from venipuncture sites. Question 25. A nurse caring for a septic patient suspects fluid overload. What is the nurse's best action? A. Notify the physician and slow 4 fluid rate per protocol. B. Stop all 4 fluids immediately. C. Increase the rate to flush out toxins. D. Administer a diuretic without an order. Answer. A. Notify the physician and slow 4 fluid rate per protocol. Question 26. A patient with sepsis is restless and agitated. What is the nurse's initial action? A. Apply soft restraints. B. Administer PRN sedatives. C. Assess oxygen saturation and blood glucose level. D. Notify the family. Answer. C. Assess oxygen saturation and blood glucose level. Question 27. What is the best way to monitor organ perfusion in a patient with septic shock? A. Measure temperature every hour. B. Check capillary refill and urine output regularly. C. Count bowel sounds every shift. D. Monitor sleep-wake cycles. Answer. B. Check capillary refill and urine output regularly. Question 28. The nurse receives a report on 4 patients. Which patient should be seen first? A. A septic patient with a respiratory rate of 26 breaths/min B. A septic patient with a temperature of 102 degrees Fahrenheit. C. A septic patient with no urine output in the last 3 hours. D. A septic patient who is alert and oriented. Answer. C. A septic patient with no urine output in the last 3 hours. Question 29. The charge nurse is assigning staff. Which assignment is most appropriate for a float nurse from orthopedics? A. A stable post-sepsis patient requiring discharge teaching. B. A septic patient requiring titration of vasopressors. C. A patient requiring central line insertion. D. A newly admitted patient with sepsis and respiratory distress. Answer. A. A stable post-sepsis patient requiring discharge teaching. Question 30. What is the most appropriate nurse action after a patient with sepsis develops a sudden drop in oxygen saturation to 84%? A. Increase 4 fluid rate. B. Call the respiratory therapist and apply oxygen. C. Encourage the patient to deep breathe. D. Document the finding and continue monitoring. Answer. B. Call the respiratory therapist and apply oxygen. Question 31. Which is a priority lab test to monitor in a patient receiving vancomycin for sepsis? A. Hemoglobin level. B. Creatinine level. C. Liver function tests. D. White blood cell count. Answer. B. Creatinine level. Question 32. The nurse is reviewing discharge instructions for a patient recovering from sepsis. Which instruction is most important? A. Avoid showering for 1 week. B. Increase caffeine intake to maintain alertness. C. Contact the provider if new fever or confusion develops. D. Resume strenuous activity immediately. Answer: C. Contact the provider if new fever or confusion develops. Question 33. Which symptom is most concerning in a patient with sepsis receiving broad-spectrum antibiotics? A. Mild nausea. B. Decreased bowel sounds. C. New generalized rash and shortness of breath. D. Fatigue and loss of appetite. Answer: C. New generalized rash and shortness of breath. Question 34. Which nursing action demonstrates appropriate delegation when caring for a septic patient? A. Asking a UAP to take blood cultures. B. Assigning a UAP to record intake and output. C. Instructing an LPN to titrate norepinephrine. D. Telling a UAP to assess lung sounds. Answer: B. Assigning a UAP to record intake and output. Question 35. Which action best reduces the risk of sepsis in hospitalized patients? A. Administering antibiotics only when fever is present. B. Avoiding urinary catheter placement unless necessary. C. Placing patients in isolation unnecessarily. D. Using gloves for every patient encounter. Answer: B. Avoiding urinary catheter placement unless necessary. Question 36. What should the nurse assess for when a septic patient develops sudden hypotension despite fluids and vasopressors? A. Myocardial infarction. B. Acute kidney injury. C. Internal bleeding. D. Pulmonary embolism. Answer: C. Internal bleeding. Question 37. What is the most appropriate nurse response when a family asks why the patient is confused after sepsis treatment? A. It's a normal reaction to antibiotics. B. The infection may have affected brain perfusion. C. Confusion only happens in elderly patients. D. The patient likely has a psychiatric condition. Answer: B. The infection may have affected brain perfusion. Question 38. Which action by the nurse demonstrates the safest practice when administering 4 antibiotics to a septic patient? A. Administering the drug before verifying allergies. B. Infusing antibiotics rapidly to meet time goals. C. Confirming identity and drug against the March D. Asking another nurse to program the 4-pump. Answer: C. Confirming identity and drug against the MAR. Question 39. Which factor places a patient at highest risk for developing sepsis? A. High-protein diet. B. Immunosuppressive therapy. C. Daily multivitamin use. D. Regular exercise. Answer: B. Immunosuppressive therapy. Question 40. The nurse notes a rising trend in lactic acid levels in a patient treated for sepsis. What is the best interpretation? A. The patient is improving. B. The patient needs more antipyretics. C. Tissue perfusion remains inadequate. D. The infection is no longer present. Answer: C. Tissue perfusion remains inadequate. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!